Billy Kudla has 7 small bone fragments floating around his knee.
This month so far I've fallen 10 times.
He was slated for surgery this month. Now that's likely off the table. But he understands why.
I just can't imagine being an ICU nurse right now because nurses bear the brunt of the care of the patients and they're dealing with death on a daily basis.
Tonight, more than 600 people in Ontario are in the ICU with COVID-19. More than 400 on ventilators, stretching staffing to its limits.
One of the biggest challenges we've had, and many hospitals in the GTA and Ontario are having enough nurses.
A growing challenge, especially as Ontario plans to add 350 more critical care spaces by week's end.
We are looking at a number of ways that we will be able to increase the number of health human resources in our intensive care unit.
That includes moving people around within the healthcare system, leaning on student nurses, possibly even importing help from other provinces. But it's not that easy.
Just because you're licensed to work in one province doesn't mean you're licensed to work in another.
True, but both bodies that regulate nurses and doctors say they've been expediting paperwork to support the healthcare system for the last year. Another possibility, retired nurses. In the first wave, 700 stepped up to help, but were not needed. This time, they are. But their association head says they haven't been asked.
People are underestimating the seriousness of the situation, and so is the province.
There is another emergency option. The province can ask the federal government and the military for help. National Defence says there haven't been any such requests from the province, but its members stand ready to offer assistance. Katie Nicholson, CBC News, Toronto.